You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello, and welcome to another episode of the RN Mentor podcast. I'm super excited today to be joined by Dr. Vivienne Pierce McDaniel. Dr. Pierce McDaniel is a visionary leader and effective change agent with almost 2 decades of nursing leadership experience and more than 30 years advancing health equity, inclusion, and social justice in healthcare. She is an executive nurse consultant, adjunct nursing professor, and the ambassador for the inclusive excellence at James Madison University School of Nursing. She served as interim executive director of the National Black Nurses Association from September 2023 to March 2024. Dr. Pierce McDaniel is the immediate past president of the Central Virginia Chapter NBNA and is the vice chair of the NBNA Health Policy Committee. A prolific advocate for justice, Dr. Pierce McDaniel also chairs the Virginia Clinicians for Climate Action Council for Health Equity and Climate Justice. Dr. Pierce McDaniel is a fellow of the 2021 inaugural American Association of College of Nursing Diversity Leadership Institute. In 2024, she was inducted into the inaugural Academy of Diversity Leaders in Nursing. She is the recipient of the VNF 2020 Year of the Nurse Award, the 2022 American Nurses Association's Leadership in Ethics Award, and the 2024 NBNA's Presidential Founders Spirit Award for demonstrating outstanding leadership in nursing. Dr. Pierce McDaniel, a national presenter, has authored several publications that focus on healthcare and nursing in the Black community. Dr. Pierce McDaniel earned her doctorate of nursing practice from Walden University, her master's and bachelor's of science in nursing degrees from American Sentinel University, and her associate in an applied science degree with a major in nursing from Thomas Nelson Community College. She resides in Virginia with her husband, retired senior master sergeant Hilton McDaniel. They both are veterans of the United States Air Force. Welcome to the show, Dr. Pierce McDaniel.
Oh, thank you so much, Dr. Ali, for having me on your show. I really appreciate it. This is a great opportunity for me to talk to you. I've been wanting to talk to you for a long time.
I appreciate it. Thank you. I want to know why this Air Force thing was a secret. I saw your bio. I'm like, we've talked so many times. I'm like, this has never come up. Share.
It very rarely comes up, and I'll tell you why. So I pre-enlisted in the Air Force. I believe it was in 1970, maybe 77, 78. I pre-enlisted in the Air Force Reserves. And I, as you are a military person, I hopped from Langley Air Force Base to Dover. I was assigned to Dover Air Force Base. And what happened was, in the interim, before I went to basic training, I became pregnant. So my husband and I had to decide what we were going to do. Well, I was determined I was staying in the Air Force. So and my recruiter, and I hate to say this, and I won't say it, but my recruiter insisted that I still go in to basic training. Well, I was one of the persons as an aeromedical specialist that gave the inoculations to airmen that were coming in and also to people that were already in the Air Force. So I knew all about what these inoculations could do to somebody. Well, I was in basic training for 3 weeks, 4 weeks. I had put it off, getting my inoculations, and I couldn't put it off any further. So I had to tell them, look, I'm pregnant. I cannot get these inoculations. So I got, and I thought I was going to get a medical discharge, but I received the honorable discharge. But
wow.
I had to go to casual. So when I went to casual, I was in long enough to become a Air Force veteran, a veteran.
Oh, wow. Amazing.
So the story is bothersome to me. And don't ask me, why didn't I go back after I had my child? I never thought about going back after I had my child. But I am a veteran. It's on my driver's license, and I have a DD 214.
Yeah, that works. That works. Awesome. Well, it's good. It's a good story, and if nothing else, it's a good story. Thank you for your service. I'm sure a lot of people are now inoculated because of you. So that works. That works.
Yeah.
Outstanding. Yes. All right. So let's get started. So you and I have talked, and I know nursing is not your first career, but what made you decide like nursing was going to be your next career, with whatever you were doing before? And please feel free to share what you were doing before.
Well, thank you for asking that question. Actually, I had a robust career in healthcare administration. I worked with physicians. I was a practice administrator for large groups, practices. And prior to that, I did a little bit of everything. I always like to say, what's that saying, that jack of all trades? And I was a master of none until nursing. Yeah. but I did work a little bit with musicians, jazz musicians, rap musicians from different genres.
Wow.
And then I also did photography for 13 years. I was a freelance photographer. I worked with the New Jersey Nets and then with the Boston Celtics.
Wow.
So almost 13 years with the Boston Celtics as a freelance photographer, which was very exciting. That was in the 80s until 1999. So it was an exciting time for the NBNA. For the NBA. I always say NBNA because
that's second nature to you by this time, right?
Exactly. So what got me into nursing is that I was working at this hospital. It was the first psych hospital in the United States. I think it was erected in 1772 in Williamsburg, Virginia. And I was working at this hospital, and I had a supervisor who was dropping microaggressions on a daily basis and saying things to me that she shouldn't have been saying. Like when she found out I did photography, she told me that Black people should stick with sports because their bodies were built for sports. Yes, that's what she told me. So my husband at the time, he had retired from the Air Force, and he was working for the director for this hospital, the CEO, and he told me that the community college was coming through and that they were looking for nurse aides and LPNs to join their program to become RNs. Now, I was neither one of those things. I had worked as a nurse aide way back in the early 70s. And but at the time, I was working as a certified coding specialist. So I decided, I'm going over and listen to what they have to say. So what got me was that they said we will pay you for 36 hours, but you only have to work 20 hours. So I was like, oh, wow, I only have to spend 20 hours with this lady who clearly does not like the hue of my skin, does not like me because of the hue of my skin. And this is a great opportunity for me to get out. And I had no desire to be a nurse. Mm. So, I got into nursing. I finished my program, did very well in the program. And then I started teaching the nurse aid program a few years later. And one of my cousins, she had already started her program, getting her, I think she was doing RN to BSN, and encouraged me to go and get my BSN. That's how my love for nursing started.
Amazing.
So, yeah, I got into that BSN program, and after that, the sky was the limit. Moved right into my MSN program, and then my Doctor of Nursing Practice program, and just so grateful to my cousin for even, telling me that I should go ahead and further my education.
Yeah, yeah. What a great story! Just because so many of us do things to either get away from something or to spite someone.
Right.
I can easily say there's a few people in my life that would like, oh, he's never gonna do this or that, but excuse me. But ended up going into my various programs anyway and doing rather well. So it's really interesting. What did you do from a perspective of like your first when you first entered into the nursing world?
So when I first entered into nursing, I was a telemetry nurse. I wanted to be an OR nurse, but they did not accept me into the program. They had a program. Some of my colleagues did. Some of my classmates were able to get into the program. I started out as a telemetry nurse. I worked with some of the best nurses ever. I was in Williamsburg, Virginia at the time, and I absolutely loved providing care to my patients. We had nurse aides that certified nurse aides or nurse aides that were working on the floor, but I provided all of the care for my patients. Wow. I did everything for them, and thoroughly enjoyed it. I started out, I believe, working 7A to 7P. And then I changed to night shift. I have no earthly idea, except for there were more people who looked like me working on the night shift. Could be the reason why. And I loved working with those nurses on that night shift. We gelled very well, and they taught me everything that I needed to know about providing care for that population of patients.
Yeah.
And the funny thing about that is about a year into me working there, there was a patient from an assisted living facility. And the patient was, I think he was probably about 100 years old. This man was still driving. He was still driving and playing golf 3 times a week. So the patient took a liking to me, and I think the director of nurses came over to visit him. And when she came over, she looked for me because he had been talking about me. And so she met me, and she pulled me to the side and said, "Can you please come and be the director of nursing at my assisted living facility?" And I'm like, wow, I'm just into nursing for a year. Yeah. She had looked at my background in leadership and in administration the 20 plus years before I got into nursing, and decided that she wanted me to come and work for her. So I did. I went and interviewed, and I got the job, and I thought it was my dream job. But again, things kind of have a way of rearing their ugly head So here we go again with how did she get this job? She only has an associate's degree. So how did she get the job?
Yeah.
Not thinking about the fact that I had all those years of administration and leadership before. And perhaps they did not know that, but I loved that job because, of course, I had worked in long-term care before, and I love my older adults, working with older adults and in that environment. So I was only on the floor for a year before I went to this other role.
Yeah.
And I continued to work part-time so that I wouldn't lose my skills.
Right.
But from then on, it was leadership.
Yeah. Amazing. How did you decide, like, you were going to, well, you mentioned, I think it was your cousin, right? That had you go on to your master's. How did you decide, like, your master's and your doctoral program were going to be part of your journey?
Well, another great question, because when I got into my bachelor's program, I started learning about leadership in nursing. I started learning about advocacy. I started learning about policy. And so I decided to go to do my master's program and with a focus on executive leadership in nursing. And then I was in my policy and my advocacy and policy class, and that was it. Once I got in that class and I learned all of the things that had to do with advocacy and policy, I felt like I had to go further, I just for a policy class. I mean, I could have just taken a class.
I just left it at that, but that didn't happen. Exactly, you got hooked. Exactly, you got hooked.
Exactly. I was hooked. So, but the truth of the matter about that doctoral program was the fact that I had done my master's program, and I thought that was going to be enough for me to teach at a university, not doing clinicals.
Yeah.
Because again, remember, clinicals, the clinical aspects of nursing were not my strongest point.
Right.
So when I graduated with my master's, and then I was told, well, the only job that we're going to give you is one, where you're a clinical instructor. I was like, first of all, that's okay, because I've been an instructor and I paid my dues. I want to be a professor.
Right.
So I went back to get my doctorate, mostly so that I could teach at that level. Also because I wanted to teach online mostly. And so I was told that I could not do that without getting my doctorate. And I considered my PhD, but I'm a doer. And even though I love research, I love implementing projects, putting them into, I love the action part.
Yeah.
So that's what made me decide to do the DNP program as opposed to doing the PhD program.
PhDs are doers too. So
well, I know you're doers. I'm not saying that you're not.
I'm just messing with you.
I'm not saying that you're not. I had learned from some of the best of them. And I remember a lot of my researcher friends saying to me, by the time we conduct all of our research, and we write our articles, or we talk about all of the things that we learned from our research.
Yeah.
Then it has changed.
Yeah.
So that was the other thing. I let someone tell me, and I still believe this actually, that people that the DNPs are able to put it into practice quicker.
Yeah.
So, I felt like, okay, so I have my researcher colleagues. I'll just take what they have researched and I'll put it into practice.
Yeah. And that's the essence of a DNP program. So it makes sense. It makes sense to go that route. That's awesome. That's
Absolutely.
Awesome. Now you've had an opportunity, just because I know you've had an opportunity to be in some very influential positions within the world of nursing and doing a lot of advocacy work. How did you get involved in that stuff? How did you get involved with the specifics of putting yourself in a position where you were the one that was the expert in the room and were able to influence decisions and advocate for various topics? How did you find your way into that arena?
Oh, it was just passion and part of my DNA. So my family, I come from a family of civil rights workers, and one of my, he's actually my cousin, but I call him my uncle because he asked me to do so, for one thing. And the other reason was because he's my mother's first cousin and he was older. And so he was a civil rights worker who marched with Martin Luther King, John Lewis, and all of those persons. Wow. And I would see the work that he was doing. Well, first of all, we didn't believe, well, I'll say I didn't believe a lot of the things that he used to tell me that he did. But when I met John Lewis told me, oh, absolutely, he was right there, So, it was just in my DNA to do the different types of things that I was passionate about. One being climate change and climate action, rather. Another, just advocating for mental health because of things that I had seen within family members and friends of mine. But the way that I got there, there's so many reasons. I mean, so many things that got me to where I am today. Just putting myself in the room with the right people, volunteering to do things that a lot of people would not do, and learning from some of the very best.
Yeah.
I'm the person who, if there is an issue, I am not going through channels, which was probably another reason why I never went back into the Air Force. I'm not going through channels. For me, there is no chain of command. The command is at the top.
Right.
And so that's the person that I want to talk to, or the person that I want to help me with whatever the problem is. I can't go through those channels trying to get to that person. I'm that person who will pick up the phone and call the person that I know is the decision maker. So I think just being in the room, putting myself in the room with those persons and listening to what they are saying to me, having them as official and non-official mentors. Yep. I had so many. Because I entered in nursing so late. I was 49 when I finished the associate associate in nursing program.
Wow.
So I had to hurry up and do the things that I had to do. Okay.
I feel a little bit like that. It took me 10 years before I went back to school. I spent 10 years in the military. So sometimes I feel that hurry up components, because I'm I'm a few years behind some of my colleagues that started out when they were in their early 20s or late teens. And
I've learned so much from them. I'm with nurses who have been in the profession for over 30 years, and they're so much younger than I. So, but I'm still learning so much from them. But I've always been this way, though. have always been the person who I put myself up there. Before I was in nursing, I used to work at this place in New York, and one of my friends, the person who got me into the photography, there was this place that we would go to, and I would be the only non-drinker. So we're sitting there at the bar, and I'm sitting at the bar with the brother to the ambassador of Somalia, the heir to I believe it was Doubleday or one of those publishing companies. We're all sitting around. I'm talking to them as though I belong. Well, they made me feel like I belong. So I always. I was a country girl. I was born in a rural town of maybe 400, if we had that many, with a yellow light that a traffic light that only blinked yellow. Well, now we have a full one. Now we have a full one. But I mean, I grew up across from a cornfield. Yeah. So to be there and they were making me feel like I belong, I just kind of felt like, hey, I can do anything. So no one, as Dr. Beverly Malone says, she did what she did because no one ever told her that she could not. So
that works. Excellent. I'm a little bit jealous of your John Lewis story, having met him. Because I had a short opportunity, right, a few months actually before probably he passed, work with his office around some veterans work that they were doing with the state. So I had the opportunity to work with his office, and there was plans for me to actually go out there, and he started not feeling well and passed away. But incredible man, did a lot of great work.
Still saddened by that. I interviewed him just probably, I can't even remember, maybe it was 6 months before his diagnosis. I had interviewed him, and I did a little write-up about him in our Virginia Nurses Today here in Virginia. But he was just so wonderful. And like I said, when he showed me in his book where my mother's cousin was in his book. His name was Reverend Curtis Harris. And he showed me in his book, that there he is. He just shared a lot of stories with me about what happened on the bridge. And it's just so sad. Yeah.
That's amazing.
And sorry you didn't get that opportunity.
Yeah, he was like, one of the things that actually, resonated with me, having worked a little bit on some of those topics that I had been working on with veterans and benefits and some of the issues around that. Like, he actually grasped the idea of what was going on really well. And it was good. It was for me, it was very fulfilling to see that he had actually heard, listened, understood, and I was taking action, right? And I think that's what resonated with me when working with his office. So great. I'm glad we had him around while we did.
Yes.
Amazing. So let's talk about you mentioned climate action, and I want to touch on that because we don't see a lot of nurses. I know there's pockets of it. I know California has a pocket of it that are doing climate action work. What does that really mean from the work that you've done, or from the perspective of nursing engaging in climate action work?
That's a great question. I got kind of involved in it because my cousin is married to, he retired, but Congressman Bobby Rush, who was involved in energy and climate action, and also Congressman McEachin, Donald McEachin, who passed, who was here in Virginia, and now Congresswoman Jennifer McClellan, who's also in Virginia. She was a senator here before she became a congresswoman. And so because of the work that they were doing here, I started getting an interest in that type of work. But also, when I was invited to become a member of the Virginia Clinicians for Climate Action, they contacted me when I was the president of the Central Virginia Chapter of the National Black Nurses Association. They contacted me and they were asking me about nurses who would be interested in doing it. And of course, I jumped right on it because I had started getting involved in that work. So here where I am in Virginia, they started reaching out to me to be a speaker. Mm. And one of the things that kind of resonated with me about all of that is where I lived. And so I lived in a small rural town. I was telling you about it. And there was a really big a dump, if you know what I'm talking about, where they would put the trash. Right. But not only that, we had this power plant that was in Surrey. Wow. That is still in Surrey County. And across from Cousin Curtis's house was a chemical plant. Wow. Where a lot of our family members worked. But I looked at where this chemical plant was located, and it was right in the section that was mostly populated by Black people. Wow. And I started looking at things like where railroads were laid. Right. All of those things, and I started looking at it from the perspective of a person who's Black from these populations. And I'm like, how is it that all of these things are in our neighborhood? So it was really born, the passion to do this work was born from out of that. But then I did have a few people who kind of pushed me out there to do it, mainly the people that are members of the Virginia Clinicians for Climate Action. So I was very blessed to be part of a group of nurses who just visited the White House and EPA to talk about climate action and what climate change is doing to the health of, first of all, to our planet. Right. And secondly, to people, especially people who are historically living in historically marginalized areas or communities. So that, I feel that we are not doing enough in that. I don't remember ever learning about that when I was in my nursing program. So that is something that we are trying to push for changes in that to make sure that it's being incorporated in these nursing programs, because students need to know about the impact of especially the extreme heat from from the climate change. So I was really grateful for the Alliance. I always get it backwards. I'm going to try to say it right. The Alliance of Nurses for Healthy Environments. I'm so grateful for them for reaching out and convening this roundtable with I think it's the CEQ that we met with at the White House. It was truly a blessing to be there and to be able to speak. Yeah. And to talk to them, at the White House about what problems we were seeing in nursing and how they could help us. Yeah.
Yeah, that's amazing. Yeah, and I know there's I'm part of the California has a similar group, and I get their emails on fairly regular basis. But it's really good to see how nursing has engaged in that area. But you're right, it doesn't
Hmm.
exist really in any of the curriculum. We're not seeing it anywhere else, and nurses don't even see it as an option for them to work in this area.
Exactly.
So I think we have
Exactly.
some ways to go with
We
that.
have some work to do
Yeah.
there.
And by the way, I have to mention, I do always see you with your camera at these conferences, and I can attest to your professional photography capabilities. So
It's never far away.
I appreciate it. It's always appreciated. Because God knows when you ask some people to take pictures, it comes out all kinds of ways.
Right. And
Head cut
everyone who
off,
knows me,
arm cut off.
yes. And everyone who knows me knows I'm a perfectionist when it comes to my pictures and how they
Yes.
look. And sometimes they're not how I want them to be. But I believe that it's very important that we capture, these moments.
Yes.
It's so important. And being the historian for my class, when I first went to nursing school, which by the way I had to fight for. Uh, the only reason why the only reason why I got it was because I said that they weren't going to get any of the pictures, and I had been taking pictures from the time we first got there until the time we ended. If I'm not the one of the historians, then you're not getting my pictures. So
You blackmailed them into the role.
I did.
That's awesome.
So, but I just think it's very important that you can look back on these things. It's like Dr. C. Alicia Georges started the Black Nurses on Capitol Hill Day. And when I go back and look at those pictures that they were taking, they were engaging with the President of the United States and all of these other Congress, these legislators,
Yeah.
And I
Yeah.
just think it's very important that nurses see that, to know that, hey, you can do that, you can do this as well.
Absolutely. Absolutely. Yeah. And there's so much important work that can be done. And again, one of the reasons
Yeah.
I do this podcast is primarily to provide opportunities for people to listen and see what nursing is doing out there outside of the four walls of the hospitals and the medical centers, and
Yes.
what we expose our primary our students to. We do so much more work that still needs to be done, and needs our voice, that we're not everywhere we're supposed to be. So
Yeah.
I
Oh,
appreciate your voice in the matter. So thank
well,
you.
thank you. Thank you.
Um, I want to be cognizant of our time. So I want to ask you a couple of questions. So you have been an active member of the National Black Nurse Association, um, and towards when we look at social justice and diversity and equity, and we know nursing is still far behind from where it needs to be. What kind of work does nursing really need to do? Like, what's missing out of the equation that's keeping us from achieving this goal? Because a few years ago, like the whole DEI thing kind of really took center stage. And I know a lot of people jumped on board and said, we have a DEI person, but the work seems to like end at the person, right? So the investment definitely needs to be greater from for in the nursing profession. But in your opinion and your experience, what's missing from the equation? What is nursing not doing to get us to that next level?
Well, see, the response that I will have for you is so simple that it may not be what you're looking for from me, but it really is all about love. Love is what's missing.
Yeah.
Because there's so much hatred, so much I don't want to say jealousy. Maybe I'll use envy and all of that. There's enough room for everybody. I mean, I feel that we miss out on so many things because of these stereotypes, these, biases and all of that. And the way that I feel about the whole DEI thing, we use that acronym, for diversity, equity, and inclusion. And some people throw in belonging.
Right.
And if you really are caring enough, you'll throw in accessibility and some other things, right?
Right.
But in order for you to move forward, you have to understand the reason why there are all of these different associations that exist. And if you really want to see everybody come together, you have to be able to understand that we are different. Because people will come to me and say, well, we're not different. We're all the same. When we cut, we bleed red. Yeah, well, sometimes some people that cut and bleed red, they get services quicker than other people when they cut and bleed red. So I'm just saying that I know you're looking for some profound answer from me, but I'm telling you, love wins, and it wins every time. If you really care about people, then you will look beyond all of the other things that you thought existed. Because the stereotypes are in our textbooks.
Yep.
They're in our textbooks. They're everywhere. So, and God knows when I go on social media and people don't understand, I really don't care that much for social media. A lot of people think I do because they see my pictures out there and they see all of this. I really don't care for it because of the negative words that I read, and people think words don't hurt, but they really do. And it's very bothersome to me. I feel that we could all come together and we can put our heads together and we can get this done appropriately.
Yeah.
For the Black Nurses Association, for organizations like DNPs of color, stop asking why they exist. They exist because we are still not understanding and appreciating people for who they are.
Yep.
That's the problem. So I know, again, you were expecting something very profound from me, but I'm going to maintain that love will keep you from looking at people that are from the Middle East and thinking they're terrorists. It will keep you from looking at Black people, a Black man walking down the street and you clutching your purse closer to you. It's that. I know it sounds crazy, but again, it's very simple.
Yeah.
And we all just need to practice it a little bit more, I think.
Yeah, I agree. Love is a pretty profound answer.
Yeah,
it's not a simple answer, because if it was a simple answer, you would have more of it. So
well, you're right. But I do recommend. What I do recommend is that if you are a nurse or student nurse, just new to nursing, you do need to join some organization or some association, some nursing organization, because it's there that you're going to not only have colleagues that can help you along, but also you'll find that most of these organizations do have advocacy. They're involved in advocacy, and more, we're trying to get more and more nurses to go to become legislators.
Right.
So those are the things that I would like to see done.
Yeah, that's great. That's great. We are about time, and I want to keep talking to you, but I'm going to give you the last word. Anything else you'd like to share with our audience?
I always leave with the words of the late great John Lewis, Congressman John Lewis. If you see something that's not right, that's not just, please say something and get into good trouble. Good trouble. Necessary trouble.
Yes.
I didn't say it quite like him, but that's the gist of it.
I appreciate it. Well, thank you so much. I really do appreciate you being on the show. We have been listening to Dr. Pierce McDaniel, and an amazing conversation. I don't think I've ever laughed so much in any of my podcasts, but so I appreciate that. So thank you for being here, and I look forward to bringing you more incredible guests in the near future. Thanks for tuning in. Have a great one. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.